Okay, we're back talking about poor leverage in the body, and this time we're going to talk about the hip. So, similar to the shoulder, and in the shoulder video, I forgot to make this analogy. And it's similar with the hip. So, if you have, let's say you were out fishing and you got a big fish and you decided to pull the fish out with both your hands at the bottom of the pole, okay? So imagine my hands are the muscles, okay? And so the muscles in your body are pulling up on this heavy fish when you're fishing, okay? You wouldn't do this. Of course, you would grab up here for better leverage, okay? Nobody fishes down here. But this is what the shoulder has to do, and this is also what the hip has to do. So just appreciating that poor leverage helps us to treat these issues and sometimes avoid these problems. So as in the shoulder, we again have poor leverage at the hip, and these are called the hip abductors. And now this skeleton, it only goes out this far, so I can't show you true hip abduction, which would go all the way out here. But that's okay, because our hip abductors don't work most of the time out here unless we're doing dance or kickboxing. The most important function of our hip abductors is to hold us up straight when we walk, because walking is a series of balancing on one foot. You balance on one foot and then you take another step. Okay, it happens fairly quickly, so you don't have to have great balance. But in rehab, when we test people on their balance for more than a few seconds, sometimes that's where we see the weakness here. So the most important function of the hip abductors is not exercise and kicking out to the side. It is to hold us upright so we don't fall down. So we're going to see if we can take this guy off the base here for this demonstration. So when you see someone walking and they have weak hip abductors, let's say they've had a total hip surgery, something similar, or they have arthritis and pain, when they land on this side, they're going to tilt over on this side, okay? And this is called the Trendelenburg gait, where they tend to lean over on that side. And what they're actually doing is overcompensating for that weakness. So this isn't, it's in pain or it's too weak to where you step on this side, it can't hold us upright, so we would fall over that way. So to compensate, we lean over this way, okay? And that has implications for cane training too. So we can review that again later. So because of this weakness and pain, this is where we start to see bursitis in the hip. It's right on this ridge here when we push on people. This poor leverage causes a lot of issues. And of course, we want to make the hip abductors stronger so this doesn't keep happening. And there's a lot of different ways we can do that. Traditionally, when I started back in the business, you know, we had people lay down and then they would, you know, raise their hip to the ceiling, okay? So that wasn't always the best way of doing it, okay? Now, we can see a lot of hip weakness when people try and do that, but the problem with that exercise is the foot is not planted, okay? Now, the most important part of the hip abductor is when the foot is planted, okay? That exercise is when the foot is out in the air, and so it's going up and down towards the ceiling. So my favorite hip strengthening exercise is to have people look in the mirror and they're going to step up and down on a step on this foot, and we're going to try and keep the hips level and get that feedback. People can correct it when they can see it. And that's what I think makes this stronger in a more functional manner. We can still do those hip abduction kicks towards the ceiling. That's still going to help, especially if you can't do it. If you can't lift it up, we want to get you to that point. Bridges are a good exercise, and I have pictures in those articles for bridges and clamshells. Now, at least with the bridges, the foot is planted on the ground, but it's still not mimicking this motion. So respecting the poor leverage here at the hip also gives us some answers and clues as to why we're having so much pain here. We have bursitis, or sometimes there's arthritis in the hip. So sound good? Okay, we'll do more leverage videos and more with the skeleton, so please check back. Please subscribe. All the subscriptions are free, and share with others. Thank you.